Hello everyone. In this video, I will be reviewing a small interfering RNA, siRNA lipid lowering therapy, Leqvio, Inclisiran, which was approved by the US FDA in December 2021. Inclisiran is an injectable medication for reducing low-density lipoprotein cholesterol, LDL-C, in adults and pediatric patients with hypercholesterolemia. Now, let's dive into this medication in more detail. Inclisiran, brand name Leqvio. This medication was initially approved by the US FDA on December 22, 2021, and currently indicated as an adjunct to diet and exercise to reduce low-density lipoprotein cholesterol, LDL-C, in adults with hypercholesterolemia, in adults and pediatric patients aged 12 years and older with heterozygous familial hypercholesterolemia, HeFH, in pediatric patients aged 12 years and older with homozygous familial hypercholesterolemia, HoFH. Chemically, inclisiran is a chemically modified anti-lipemic small interfering ribonucleic acid, siRNA, in acetylgalactosamine (GalNAc) conjugate. Leqvio is a second-generation PCSK9 inhibitor with the molecular weight of 17,285 daltons. Notably, the first-generation PCSK9 inhibitors are monoclonal antibodies such as Preludin and Repessa, which were approved by the US FDA in 2015. The third-generation PCSK9 inhibitor, Leqvio, a fusion protein therapeutics, was approved by the US FDA in December 2025. Leqvio is available as 284 mg per 1.5 milliliter, which is 189 mg per milliliter, in a single-dose pre-filled syringe for subcutaneous injection. With regard to storage and handling, store Leqvio at controlled room temperature, 20 to 25 Celsius, which is 68 to 77 Fahrenheit, with allowable excursion between 15 and 30 Celsius, 59 to 86 Fahrenheit. Recommended dosage for adults and pediatric patients is 284 mg administered as a single subcutaneous injection initially, again at 3 months, then every 6 months. In addition, Leqvio should be given by a healthcare professional. Mechanistically, this small interfering RNA medication works as a protein convertase sublysine catalysin type 9 PCSK9 inhibitor. Specifically, the triatenaryl in acetylgalactosamine sugar molecules are designed and used to facilitate the hepatocyte uptake. Inclisiran works to selectively target the liver, utilize the RNA interference mechanism, causing the catalytic breakdown of PCSK9 mRNA. This leads to the increased LDL-C receptor recycling and expression, increased LDL-C uptake, and lowered LDL-C levels in the circulation. Pharmacokinetically, Tmax, that's the median time to reach the maximal plasma concentration, is about 4 hours. The apparent volume of distribution is about 500 liters. Protein binding is 87% based on in vitro studies. Metabolism. Inclisiran is expected to be metabolized into short nucleotide fragments within the liver by nucleases. The terminal elimination half-life is approximately 9 hours. Excretion. About 16% of inclisiran is excreted renally. Drug-drug interactions. No formal clinical drug-drug interaction studies have been conducted. Inclisiran is not a substrate, inhibitor or inducer of cytochrome P450 enzymes or transporter. Contraindications. Prior serious hypersensitivity to inclisiran or any of the excipients in Leqvio. The most common adverse effects, greater than or equal to 3%, include injection site reaction, arthralgia, and bronchitis. Here is the key reference which I have used to prepare for today's video. Most of the medication information which I shared today is based on Leqvio prescribing information. This document is available at the US FDA drug website, along with the drug manufacturer website. In addition, if you like this video, please check out my other PCSK9 medication video, Lyrical, which is a third-generation small-binding protein PCSK9 inhibitor. Finally, I want to thank you all so much for watching. If you find this video helpful, subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.